Good morning, and thank you all for attending. Today I'm joined by Dr. Carol Zimbalati, public health physician, who will provide an update on our local COVID-19 situation, and Andrea McCollum, director of our COVID-19 immunization strategy, who will provide an update on our vaccine rollout. Before we proceed, I would like to take a moment to acknowledge that the health unit resides in land covered by the Robinson-Huron Treaty of 1850. This land is the traditional territory of the Anishinaabe people. This land is also part of the unceded territory of the Algonquin Nation. I would also like to acknowledge the Métis historical presence in this region. As we celebrate the world of sport over the next 2 weeks, we are reminded of the barriers that many Indigenous people must overcome, including poverty, isolation, health issues, intergenerational trauma from residential schools, and cultural barriers to be able to perform on the world stage. So let's continue to work together to help recognize and remove these barriers as part of the decolonization and reconciliation process. Next week, we will not be hosting a press conference. Our next press conference will take place on Thursday, August 12th. Media are still encouraged, however, to send questions to the Health Unit's media line if you have any. There has been a lot of talk about travel and mixing and matching vaccines. All our clinics now offer both Moderna and Pfizer, and mixing and matching is safe and effective. The province and federal government are working to address the international acceptance of mixing and matching vaccines. Those who used a mixed vaccine schedule to get the first vaccine available to them made the right choice. I think we would have been in a far worse position in terms of cases if many people had decided to wait for a second dose of the same vaccine. However, both vaccines are now typically available at all of our clinics. This week, BC has seen an increase in cases, with less than 5% of the infections being in people who are vaccinated. Locally, our numbers are similar. Over the last 14 days, July 14 to 27, 92% of individuals eligible for the vaccine who tested positive for COVID-19 were not fully immunized. A further 5 cases were under the age of 12 and not yet able to be vaccinated. As the long weekend starts tomorrow, I continue to encourage everyone to consider the risk before attending social gatherings and follow public health measures to help prevent the spread. If you haven't done so already, please get your COVID-19 vaccine. So with that, I'll pass it over to Dr. Zimbalati.
Thank you, Dr. Chirico. In the last 7 days, we have only had 2 new cases, bringing our total case count to 652, with 470 in the Nipissing district and 182 in the district of Parry Sound. The health unit currently has 7 active cases. There's currently 1 active case that has a preliminary positive result for a VOC, a variant of concern. 21 cases in our district have tested positive for the Delta variant, but all known Delta variant cases in our district are now resolved. Currently, there are no individuals in hospital due to COVID-19. With that, I will pass it back to Dr. Chirico.
Thanks, Dr. Zimbalati. And now we'll have Andrea give us an update on our COVID-19 vaccine rollout.
Thanks, Dr. Chirico, and good morning, everyone. As of yesterday at 3 p.m., we are now at 77% of residents 12 years of age and older who have received at least 1 dose of a COVID-19 vaccine, and 66% of residents 12 years of age and older who are fully vaccinated. 62% of youth aged 12 to 17 years of age have received at least 1 dose of the vaccine, and 40% have received both. As of yesterday, a total of 163,059 doses of COVID-19 vaccine have been provided in our district. The ministry has set targets of 80% uptake for first dose and 75% uptake for second doses of COVID-19 vaccine. These targets are part of the criteria to move out of stage 3 of the reopening plan. For our district, as of yesterday morning, this means we need 3,658 individuals to receive their first dose of COVID vaccine and 11,020 individuals to receive their second dose of COVID vaccine. As the demand for COVID-19 vaccine starts to plateau, we are adjusting the way we will be offering our clinics. We have canceled several clinics due to exceptionally low bookings. Everyone who was scheduled in a clinic that has been canceled has been contacted either by phone, email, or direct letter to inform them of the cancellation and offer an alternative date. As part of our plan to reach people and reduce barriers, all of our clinics moving forward will be accepting walk-ins, and smaller pop-up clinics will be taking place throughout the district. Confirmed pop-up clinics over the next week will take place in Powassan on Tuesday, August the 3rd at the Powassan Sportsplex from 4 p.m. to 7 p.m. River Valley and on August the 4th at the Golden Age Club from 10 a.m. till noon. Verner on August the 4th at the Verner Arena from 2 to 4 p.m. A number of other locations are currently in the planning phase and details will be shared as they are confirmed. Additionally, we have been able to identify through the COVAX reporting system that there are approximately 5,000 individuals in our district who have received a first dose of vaccine, but are not currently booked to receive their second dose of vaccine. And we will be reaching out to those individuals to assist them to access their second dose of vaccine. We hope to see you out in the community and will continue to work to reduce barriers for those wanting to get their COVID-19 vaccine. Now I'll turn it back over to Dr. Chirico.
Thanks, Andrea. So that ends our remarks, and we'll be able to take questions now. So please just put them in the chat box on the left of your screen and attach your name, and we'll try to get as many as we can. And if we don't have the answers, we'll get back to you. Turn it back to Alex.
Thank you. So our first question is for Dr. Zimbalati. It comes from Jennifer from the Nugget. Those who contracted COVID-19, are they being encouraged to get vaccinated as soon as they can, or because they had the virus, their immunity is good enough to protect them and they don't need to be vaccinated?
We are encouraging everyone, regardless of whether they have had COVID-19, to still be vaccinated. There is evidence that there is better protection from receiving the vaccine than you would get solely from having the infection.
Thank you. Our next question is for Dr. Chirico. It comes from Eric Tashton from CTV News. Outdoor gathering limits are set at 100 people outdoors. This weekend, the PPC leader is set to attend an anti-mask rally in the city. What is the health unit's response to this? Are there concerns this rally could exceed the current gathering limit?
Yeah, similar to gatherings we've had in the past when we've been under restrictions, we ask people to really be mindful of others and to follow public health measures and not to exceed gathering limits. And for individuals, you really have to consider your individual risk and the risk to other people too. And if you're not fully vaccinated, if you don't know if other people that you're going to be with are fully vaccinated, you need to take precautions. And so we hope that certainly they will adhere to the public health restrictions. Yes, because make no mistake about it, we're still dealing with the Delta variant. Numbers are low, that's fantastic, it's great. And they're low throughout the province. The healthcare system is functioning well, but this variant is increasing throughout the world. It's increasing in the United States. We're starting to see pockets of increases here as well. And the best protection that we can offer is for everyone to get vaccinated. And that continues to be the message. And to follow public health measures, do a risk assessment when you are out.
Thank you. A follow-up question to that from Stu from Bay Today. Even if the outdoor gathering is adhered to, is the event concerning enough from a public health standpoint to warrant intervention? Because many of its organizers and attendees have spoken publicly against vaccinations and are possibly unvaccinated.
Again, this represents a very small minority of people. We know that vaccines are effective, they're safe, and they have saved lives. We don't want to go back to a situation where those most vulnerable are at risk. And certainly we know that what happened with the elderly. I believe that we need to follow the public health measures. I wouldn't encourage. I think the masking issue is certainly one that people have concerns about, but it has been shown to be very effective if done properly. And as part of the public health measures that have helped to keep our numbers low in our district and throughout the province, relatively speaking. So we've done very well, and I think we need to continue to do the same.
Thank you. Our next question is also for Dr. Chirko. It comes from Clark from Cogeco News, your TV North Bay. Good morning. What concerns do you have regarding the approaching date to reopen the Canadian-US border for non-essential travel?
Again, I think that it's premature given the concerns that there are with the Delta variant. Cases are increasing in the United States, and they're increasing in states especially rapidly that don't have high vaccination rates. So I think that we need to be very careful of what we open, what we don't open. This is not over, and areas where you see where they aren't following precautions, we're seeing increasing cases in Canada. So I would not be in favor of it just yet. We need to follow this very closely.
Thank you. Our next question is for Dr. Chirko. It comes from Rick Coffin at mynorthbaynewsnow.com. If the province reaches its vaccine targets and moves to the final stage, but our region does not reach these targets at the same time, would that mean we automatically can't move to the next stage with the province?
That's a very good question, and it still remains to be determined by the province. We don't know what that's going to look like, and we certainly just are following very closely. And again, we're really really glad that Andrea spoke about the numbers that we need to get to those kind of targets, and not simply just, oh, let's just reach the numbers. The numbers are there to help get to a level where, we can certainly help prevent people from being hospitalized, from people dying, and ending up on ventilators. We came very close in the third wave, certainly, to having the healthcare system get to a point where it could have been overwhelmed very easily. We don't want to go there again. So it's going to be very helpful for those reasons. It's also going to be very helpful to get our kids back into school safely. The more we can get vaccinated, and we encourage parents to please consider getting your child vaccinated as soon as possible, so that they're protected when school does open. And we know that in the past that the best protection against school outbreaks is have very low community spread. And the only way we're going to do that, and especially with everything opening up, is to have people vaccinated, doing risk assessments, following those public health measures that we talked about.
Thank you. So our next question is also for Dr. Chirko. Comes from Jennifer Hamilton at The Nugget. Do we know what regulations and rules will be after stage 3? What can residents expect?
Yeah, thank you for that question, Jennifer. That's really important, and we're asking the same thing. We don't know, and we will certainly, once we do find out, pass it along, but it's usually a provincial announcement, and they would be finalizing that, and we don't have that information.
Thank you. And a follow-up question from Clark from Cogeco News, your TV North Bay. What should occur, in your opinion, regarding restrictions following the end of the 21 days for step 3?
Well, I'm glad, thank you for that, Clark. I'm glad that you put in the 21 days because that was the original plan, and we really need to wait the 21 days. And I think that what it really is going to come down to, and because the pandemic can shift very quickly, we'd be able to better determine that with a multiple of factors to consider closer to the time that they're going to be making those decisions. I know it's coming up, but I don't think we can tell just yet.
Thank you. For Dr. Chirko from Stu from Bay Today, respectfully looking back over the course of the pandemic, what is one decision you would alter or even take back?
I don't know. That's a good question. Certainly, we all make mistakes, and there's lots of judgment calls. I'm going to have to think about that one.
Thank you. Our next question is for Dr. Zimbalati. It's from Jennifer from The Nugget. Do we know how long the COVID-19 vaccine will protect us for?
Jennifer, that's a wonderful question, and it is an area of study currently. Pfizer has done some preliminary work in terms of trying to determine that and whether a booster will be necessary. They are recommending a booster. However, I think more external research needs to be done to confirm that and to confirm how long the immunogenicity, the protection lasts for the various vaccines. Some early indications out of a recent study in Israel may show that there could be waning immunity with vaccines, but we really don't have enough information to make that call yet. So that is, it's evolving, an evolving area of research, and when we know more, we will definitely be sharing that, and we'll also be following the recommendations of NACI and the Ministry of Health in terms of booster doses.
Thank you. Our next question is for Dr. Chirko, comes from Eric Thompson. The goal is to have at least 75% fully vaccinated in order to enter stage 4, but will the health unit place any restrictions on specific municipalities if they are well below the district average? I've heard some towns are only around 55% fully vaccinated.
Yeah, thanks for that question. And the answer is no, we won't be putting specific restrictions on municipalities. I don't believe that works. Want to positively reinforce the benefits of vaccines, and we want everybody to get vaccinated. And keep pushing the message as to why. But I don't believe that similar to a response framework, when you have areas that are more restricted than other restricted, people simply get around it by traveling. And I don't think it's effective means to implement. I think that it would have to be a provincial decision on what restrictions are lifted. But I would be in favor we all move together.
Thank you. This next question is for Dr. Zimbalati. It comes from Greg Exterbooks from Cogeco News, Your TV North Bay. How long will variants be a concern?
Thanks, Greg. Another wonderful question. As we still have a significant burden of illness with COVID globally, I think that there's still much potential for the virus to mutate and for new variants to emerge. So it will be something that we will have to monitor on an ongoing basis, likely for years. Some variants could prove more transmissible and cause more illness, and perhaps have more protection for themselves against vaccines, while other variants may actually be weaker or cause less illness. But it is something that we will have to continue to monitor, because the genetics it's rather random.
Yeah, and it's very similar to what we see with the flu. And again, this is not the flu. However, every year, because of different changes to the virus, it's been with us for years that the strains change and alter. So this may be the same. It doesn't necessarily mean, as Dr. Zimbalati pointed out, that they would be more severe. They could be less severe. We have mild flu seasons. Sometimes we have flu seasons that are much more severe and more deaths do occur. So it appears that this may be a similar type of situation that may occur.
Thank you. Our next question is for Dr. Chirko from Stu from Bay Today. Which health complications are in danger of increasing once public health measures are relaxed?
Well, I'm not exactly sure what you mean by health, which health conditions. Certainly if you eased up on the restrictions, there's an increased chance of having COVID-19 spread in the Delta variant. If you're referring to that, then yes, that is a real concern. And that's what we're seeing throughout the world in areas that have very low vaccination rates, that aren't following public health measures, especially with the Delta variant being so much more transmissible. That's going to be the biggest risk. It would be certainly that. I think that we also need to keep in mind that areas that have had lots of people vaccinated, and I think this is our goal, that we're going to probably have to live with COVID-19 for quite some time. But what we want to do is prevent people from getting really ill, and the vaccinations is the best way to do that. So that's why we can, and it's a good point that you've raised, like when things are loosened as far as the restrictions, that's why we continue to try to message people, do a risk assessment, your own, where you're going to be, whether you're vaccinated and unvaccinated, and to take appropriate precautions for that very reason.
And I'd just like to add that further than looking beyond COVID, obviously the restrictions have protected us from other infectious illnesses as well, other viruses. Our flu season was much less this year than it has been in previous years. So it is possible, once we see the measures lifting somewhat, that we get a resurgence of other infectious illnesses, particularly respiratory illnesses, that have also been restricted by the public health measures that were in place.
Thank you. Our next question is for Andrea. It was submitted anonymously. Andrea, are there any special strategies underway to encourage youth and perhaps those who are vaccine hesitant to get vaccinated?
Great question. We are working on a number of different strategies specific to youth. We have a team internally that meets on a regular basis and plans out different strategies to address concerns with the youth and to provide vaccines that are accessible to youth. We also meet at a provincial level to have those conversations and share thoughts with other health units. We will be offering youth-based clinics in the schools in September to make it easier for accessing the vaccine for people who may face some barriers in attending any of the clinics that we have offered. We are offering pop-up clinics throughout our district, currently working on identifying those locations that would be most suitable and getting things organized that way, and they will be advertised as well. And so we will strongly encourage our youth to attend there. As far as the vaccine hesitancy goes, we continue to try and target messaging with respect to addressing myths and making sure that people have factual information. We have obviously seen a plateau or a decline in people accessing our vaccines, which is giving us the opportunity to try and plan and identify some of those barriers that may be preventing people from coming and looking at strategies to address that. So correct information and things like that. And we are planning and hoping that we're going to see a resurgence of interest in the vaccine come September, when we're finished with the summer and starting to get back into school and routines, and hopefully be able to encourage those who are a little bit hesitant with correct and accurate information to get their vaccines.
And just to add to that too, we're trying to promote these vaccine information and getting vaccination out on different platforms than we typically would for the general population. So targeting platforms that youth would more likely be engaging in.
Thank you. Our next question is for Dr. Zimbalati from Jennifer from the Nugget. The province has recently announced different regulations for those students who are vaccinated and those who aren't. Should an outbreak occur, restaurants in Toronto are asking those who aren't vaccinated to dine outdoors. Do you expect there will be different rules for those who are not vaccinated?
Yeah, that's a great question, Jennifer. And I think it will really depend on the setting. In areas such as schools, hospitals, other healthcare facilities, I think that there will be some regulations as to what restrictions are in place for vaccinated and unvaccinated individuals, particularly if there are known cases in the institution. So there will be likely different approaches for those two groups in those facilities. When it comes to restaurants and other private businesses, I think it will largely be up to the individual business owners to develop their own policy. I don't anticipate that there will be direction from or regulation from the province on this, but we'll just have to see what emerges.
Alex, I just wanted to go back to that question that I didn't answer, if I have a moment.
Yes, you may.
From Stu about what I would do differently. One of the things, and maybe there's more, but one of the things that I would do differently is I think that I would have gotten out in front of the press a lot more readily earlier on, doing exactly what we're doing every week now, and do the same with municipalities. And I think that's one of the places where I erred, that I should have done it a lot sooner. There's a lot of questions that people have, and the questions that you all ask us every week are excellent, very thought-provoking, and it really does reflect what the public is asking. So I think that would be a big one that I would change.
And while we're going back on previous questions, the question about other illnesses, symptoms that could come out after measures are lifted. And I was describing the possible resurgence of the flu. So I think that's, I just wanted to segue with that and reiterate the importance of also getting the flu shot this fall, because there is the chance that it could be a worse flu season than we have seen recently.
Thank you. So that completes all of our submitted questions. So we will be ending our press conference. The recording is available on our website this afternoon. As well, just a reminder, we will not be hosting a press conference next Thursday. So we will see you on Thursday, August 12th. Thank you.